Now ChatGPT has become much more difficult for us because they have been posting X-rays in that, and they're asking question whether the surgeries went well or not. These are also called fast-track knee replacements. So patients tend to walk from day one.
How does robo and orthopedician go hand in hand?
Robot can never perform a surgery without a surgeon.
So welcome to the program, Dr. Vikram, and it's a pleasure to have you.
Thank you.
So we all think that, bones are hard, lifeless structures. But tell us something, what's fascinating about them that people completely underestimate?
So yeah, bone as such are hard structures, to be frank. But the thing is, over the time, as we grow in age, as we get white hair, the thing is the bone also gets weak. So most of the people underestimate that. And the thing is that once you attain osteoporosis, the thing is that your bone becomes like a sponge. So you need not fall. Even if you slip, the chances of fracture is high. So I tell many people above 50, especially women who reach menopause, to take supplements, to walk especially. So with this, the bone becomes strong.
So we all think about, heart health or brain health or liver health, but we don't think about the bones which keeps us going all along.
Yeah, that has been a major problem for a very long time. So now with this podcast or YouTube videos and Instagram, we have been trying to explain to the patients and to all other people that bone health is also very important.
But tell us, doctor, what has changed something recently? Endukante ee madhya we get to hear about robotic surgeries, replacements.
A couple of years back, we were all doing manual. That means there were certain instruments where we used to use that as a reference to cut the bones to replace a joint. But now with the advanced technology that we have at Yashoda Hospitals, Secunderabad, we have something called Smith Nephew CORI. It's a robotic, highly advanced, and with this, it is a tailor-made structure. So that helps in giving a better alignment to the patient, better pain-free joint, and the longevity of the joint is also increased. So now with this, certain patients have certain posture, and they've been walking all the life like that. So they come with a bend of around 10 degrees. And they sway when they're walking. So if I correct completely, they're not happy. So usually with the manual, try to correct completely. But with the robotic, what we do is we don't correct completely, but we undercorrect so that patient feels that they have a natural joint, first thing, and with that they get confidence to walk. These are also called fast-track knee replacements. So patients tend to walk from day one and without pain. So this has been advanced now.
So it feels more natural and doesn't feel completely different. I think that's a good thing. So the moment, someone says knee pain, it's very common. We say, okay, you have to get a knee replacement done. Is that true?
Yeah, so now this has been, many patients ask me about this. The thing is that first criteria is that age. If a patient comes in between 30 to 40, it's just early arthritis. But sometimes patients with inflammatory arthritis, they tend to have grade 4 arthritis at age 40 also. So recently, a week back, this patient from Khammam has come to Yashoda Secunderabad. She couldn't even walk. She came in a wheelchair. And when we examined and we have gone deep into the history, we got to know that she's having rheumatoid arthritis and she didn't take proper medication. So with this, rheumatoid is nothing but an inflammatory arthritis. So it eats away the joint. So she couldn't walk. So then I've explained her, we have offered a robotic knee replacement. It's been a week now. She is walking very happily. If you go beyond 50, usually that is where the arthritis starts, and this is called primary arthritis. In this, what happens is as we grow older, we get white hair. So similarly, the joint also wears out. It's just like if you're using a car for 10 years, the tire wears out. So in that we replace, right? It's same like that.
So when we have to replace our joints, especially knee joint, we hear the terminology complete or total knee replacement and partial. What exactly is the difference?
If 80% of the joint is been worn out, that is where we do a total knee replacement. But for instance, now there is only 20% of the joint worn out and the 80% of the joint is good. So in that case, you need not replace the whole joint. In this, we offer a robotic partial knee replacement, which we have been doing quite often now. So we just replace the part which is worn out. And with this, patient feels more natural because 80% of the joint is still there. So these patients tend to recover much faster.
Is it true that, partial knee replacement it doesn't last longer and you end up in total knee replacement eventually?
Before robotics, there was no much learning curve for partial knee replacement. But with the robotics, now what happened is, with the manual thing, we used to have around 10 steps to do a partial knee replacement. But with the robotic, the advantage is that we give all the data to the robotic system and it gives certain things. It says the size of the implant, how much cut you have to do, how much bone burr you have to do. So this all, what happens is, with this, the natural alignment is maintained and the longevity has increased.
So now let's talk something which is fascinating that you've mentioned about robotic surgery. I mean, it sounds so futuristic and so out of just sci-fi movie, right? How does robo and orthopedician go hand in hand?
So yeah, say robotic is just an instrument which is highly equipped with technology. But as such, robot can never perform a surgery without a surgeon. So many people think that if robotic is doing the surgery, then what is the use of a surgeon? So it is all about surgeon's knowledge and robotics technology. So what data we give to the robo, it gives certain criteria. So in this place, you have to put an implant because with this place, the longevity will increase. And after that also, we take the call and we have to work hand in hand. That is when we give good results.
So in the end, the robo is not doing the surgery and it's just like a scalpel for the surgeon antaru.
Yeah, exactly.
So from a patient's perspective, doctor, what are some advantages that the patient would be having while undergoing robotic surgery?
First and foremost is that it's a minimal blood loss. The surgery incision is very less, and the accuracy, the precision of the surgery is very, very nice. And with this, patients feel more natural and they tend to recover much faster, which doesn't happen in manual.
So they can get back to their daily routine as soon as possible.
Absolutely. And many patients you won't believe, there was a doctor I've operated recently from Siddipet. I've done both robotic knee replacements. And surprisingly, he asked me, when can I go to his hospital? So I said, at least 3 weeks you have to wait, because by then you'll be trained how to walk, how to climb stairs and all. And he just calls me and tells that I cannot stay at home, sir. And 10th day he started going to the center and he's happy. So it is all about doing and giving a good knee joint. So the confidence is very important.
Life after surgery, how it turns out is like how it matters to the patient especially.
Yes. The thing is that patients always feel that post-surgery, my life is not going to be the same. I'll be bedridden, I'll not be able to walk. And when I ask them, who told you? They say that my relative told or my neighbor told, but they don't believe a surgeon. So that is a major criteria. So whenever I do good surgeries and robotics, so I try to take patients' feedback and then I try to give that in Instagram or podcast and all, so that they'll understand what is actually happening.
So what are some important rules that all the patients should follow after surgery?
If patients are from rural areas, they tend to walk without footwear. So the first and foremost is that you should always wear a footwear and see that you don't have any puncture wounds, because the one which we are putting inside is a steel. So if you're a diabetic or if you have any comorbs where your immunity is low, chances of getting infection is high. So the first and foremost is footwear is always must. And most of the patients ask whether I can sit on the floor. Yes, definitely you can sit on the floor, but the major thing is that we put a plastic in between the steels to give a good movement. That also has a life. So just to improve the life and the longevity of the implant, we tell not to sit on the floor.
So talking about implants, doctor, after surgery, how long do you think the implants would last? Are we talking about 10 years, 20 years or a lifetime?
If a patient is at around 60, it's almost like a lifetime. But if it is done in a good hands, implant usually lasts for around 20 to 25 years.
But I'm sure the moment you say, we have to do a robotic knee surgery or robotic surgery, the first question patient would be worrying is about the cost. What's the difference like?
This question has been asked repeatedly from many patients actually, because the main worry is that if I get a robotic knee replacement, most of my savings will be gone. So I tend to explain to the patients saying that if a knee replacement is done, it has been for 20 years. So for 20 years, if you calculate, every year you have been charged around 15 to 18,000. So that is very easy actually. If you think yearly you're spending only 18,000 on your health, and you're getting a lifetime implant. That is how I try to explain to the patient.
So you have to look at the bigger picture and the longer
Yes.
picture, and obviously the
Yes.
health would matter.
Yes.
So for someone who's listening to this podcast or watching this and suffering with knee pain and is confused about surgery, what is that advice that you would like to give them?
So please don't worry. First and foremost, please get a proper opinion from us, and then I'll try to explain you at what stage you are and how many years I can prolong the surgery, or if you are in grade 4, what surgeries I can do and how I'm going to help you. So this will ease your thoughts and also will give you a better reason to get a surgery done.
So what is that one myth you want people to stop believing about replacement surgeries, doctor?
Please don't believe that if your neighbors or if your relatives tell that after the knee surgery I'm not able to walk. That is the first myth. So if a surgery is done properly, definitely you'll be walking from day one. Trust me.
I think that's more important, the right message coming from the right people, because the Google is everywhere.
Now ChatGPT has become much more difficult for us because they have been posting x-rays in that, and they're asking question whether the surgeries went well or not. It's very difficult to treat that also.
So what do you tell your patients, when they have Googled everything about diagnosis and they've come all prepared to you? How do you see that?
I tell them to ask the treatment from Google only. But keeping that aside, yeah, that has been there for quite long. Now ChatGPT has made our lives much worse actually, because they should understand that this is a cumulative data and it doesn't refer to one patient. So please do not get away with those diagnoses or treatments. Please get it verified, checked properly, and especially get it diagnosed by a proper surgeon or a doctor before planning something else.
So I'm sure, being an orthopedic surgeon, you have to spend a lot of hours in the OT and have a very hectic day. So how do you unwind at the end of the day?
I work from morning 8:30 till night 9. So after 9, I just keep my phone aside. I spend some quality time with family. I play with my kids. So this is how I try to activate myself for the next day.
So are there some lifestyle changes that you closely follow being an orthopedic surgeon?
Yeah, I meditate for at least 40-45 minutes every day, and then 40-45 minutes of workouts, and then I start my day. And believe me, this I've been following for almost 3 years, and that has changed my lifestyle, how I think, how I represent, and yeah, my stress levels have also come down by at least 80%.
So thank you, Dr. Vikram, for such an engaging podcast. It was wonderful having a conversation with you.
Thank you.